Greetings. This short video is made to commemorate the World COPD Day. World COPD Day is celebrated on November 15th, 2023. The theme for this year's celebration is Breathing is Life, Act Earlier. What is COPD? Otherwise, the full form is Chronic Obstructive Pulmonary Disease. It's a common disorder predominantly affecting the lungs or the breathing organ. It is a preventable and treatable disease. It presents most commonly as breathlessness, chronic sputum production, and cough. COPD is a common disease. Prevalence in India is 7.4% among adults. Currently, it's one of the leading causes of death worldwide. In India, COPD alone accounts for over 9.5% of total deaths. There are many risk factors for COPD. The most common risk factor is tobacco smoking, either cigarette smoking or BD smoking. There are other causes of non-smoking COPD, out of which important ones are second-hand smoke. That means that a person in the house smokes, the other people in the house gets affected by this disease. General air pollution, workplace or household exposure to dust and fumes. A common example is women in India, in the villages, they use wood and other items to burn and cook food. And the smoke emanated from that, if it is not properly ventilated, these women keep on breathing these harmful gases and they go on to develop COPD. In fact, in India, it is said that among half of the women patients with COPD, it is due to the household exposure to the smoke. There are some genetic conditions which are associated with COPD also. Also, previous respiratory infections like tuberculosis can lead to COPD, even though the tuberculosis per se gets cured. If asthma, if not properly treated, can over a long period of time behave like COPD. So what happens in COPD? This is the picture of the lungs, the main breathing organ. You can see that the trachea or the main air passage which comes from the nose divides into the right and the left lung. And there are small tubes which divide further. And these small tubes are shown here as a cross section. And this is a picture of a healthy cross section of a breathing tube, otherwise called bronchi. In COPD, what happens is it gets inflamed. That means that it gets swollen up and there is excess mucus production of this air passage. This causes difficulty in passage of air in and out of the lungs. That is one part of it. The second part of it, in the lungs, there are small air bubble-like cavities which are called alveoli. And this is a healthy alveoli. And the air exchange happens here. That means the intake of pure air or oxygen into the blood, as well as the removal of bad air, that is the carbon dioxide, happens in these small air sacs called alveoli. And in COPD, there is destruction of the walls between these air sacs. And that causes reduction in the air exchange, which hampers the breathing. What are the common symptoms of COPD? Ongoing cough is one of the common symptoms. Many times people who smoke attribute to this as a normal phenomena due to smoking, and they fail to recognize this one of the earliest symptoms of COPD. Shortness of breath on exertion, on climbing stairs, on playing is one of the symptoms. Wheezing, an audible sound which happens when they breathe heavily. Chest tightness. Repeated chest infections. They may need to take antibiotics again and again. Or simply weight loss. These are some of the symptoms of COPD. How do you diagnose COPD? You need a good history and clinical examination. The doctor needs to examine you. He may order one of the important tests called spirometry, which measures the lung function. And it is through performing this test that the doctor will know that there is obstruction to the passage of air through the breathing tubes. Doctor also will order some other investigations like sputum investigation to rule out conditions like tuberculosis, or some blood investigations, or some investigations like a chest X-ray. How do you manage a patient with COPD? It can be divided into non-pharmacological treatment and pharmacological treatment. Among the non-pharmacological treatment, the most important step is stopping smoking. Unless the person stops smoking, his condition is going to rapidly deteriorate. We need to sit with the patient, encourage him, counsel him, and assist him in the process of stopping smoking. If the person is getting exposed to other pollutants or indoor air pollution due to the smoke due to cooking, we need to find out an alternative method of cooking or improve the ventilation. Patient also will benefit from what is called pulmonary rehabilitation, which is a wholesome supportive mechanism which help patients to breathe better, to help the patient to clear his secretions inside his chest. Coming to pharmacological treatment, not only that counseling is going to help the patient, there are some nicotine replacement therapy which can aid the patient to stop smoking. This can be giving nicotine in the form of gums or patches. One of the important reasons why the patients are finding it difficult to stop smoking is due to nicotine addiction. To compensate that, nicotine replacement therapy help them in a great way. COPD patients are prone to get repeated chest infections. Vaccinations are found to be useful for influenza as well as pneumococcal vaccines. The best method by which we can give medicine to a patient with COPD is through inhalers or through small devices which carry the medicine through the air which we breathe in. These are much more effective and have lesser side effect as compared to tablets and or injections. So these inhalers can go through the breathing tubes and help the breathing tubes to expand or dilate, as well as help clear the secretions. For some patients, we may need to give antibiotics if there is evidence of infections. Over a period of time, some of these patients develop what is called respiratory failure. That means that their lung is not able to exchange oxygen into the blood. And such patients, oxygen therapy may need to be given, on a long-term basis, even at home. Not only that, we need to take care of the lungs. Such patients have other problems in their body. One of the common things is heart diseases. Smoking tobacco not only can lead to COPD, it can lead to heart diseases. So we need to evaluate and treat for the same. COPD patients can have weakened bones called osteoporosis, which can make them prone to develop fractures. COPD patients is very important to maintain an ideal body weight. Nutrition should be given much importance because both undernutrition as well as overnutrition or overweight can be harmful for the patients. Such patients, because of their chronic conditions, may become depressed. So we need to identify and treat accordingly. So the theme for this year's COPD day is breathing is life, act earlier. It's very important that we need to give importance to lung health. Early diagnosis and early interventions is very important. Once the disease is advanced, you cannot reverse the condition. It is no longer a curable condition. So early detection and early intervention to prevent the progression is very important. Keeping lungs healthy is an integral part of future health and well-being. It is now more important than ever to act sooner. Thank you.